Welcome to the Strokecast. A Generation X stroke survivor explores rehab, recovery, the frontiers of neuroscience, and how to peel a banana with one hand.
Hello, I'm Bill Monroe, and welcome to episode 15 of the Strokecast. This week's episode, fish! Last week, the American Heart Association published an article about its recommendations for eating more fish. It was actually based on a scientific study that had recently been released. The article basically recommended eating more of it, which is fortunate for a number of reasons. But to begin with, here's what the article had to say. It says, 16 years after it released its last scientific statement on the benefits of eating fish, the American Heart Association doubled down on its advice, with an advisory recommending 1 to 2 meals of non-fried fish or shellfish per week for better cardiovascular health, especially when fish replaces less healthy foods. The amount of research and science has grown so much since the last advisory came out that it was time to come up with a new statement on the beneficial effects of seafood in preventing not just heart disease, but stroke, heart failure, sudden cardiac death, and congestive heart failure, said Eric Rim, a professor of epidemiology and nutrition at the Harvard T.H. Chan School of Public Health in Boston and chair of the group that wrote the advisory published in the journal Circulation. To get the full benefits of eating fish, the American Heart Association recommends eating 2 3.5 servings of non-fried fish, or about 3/4 cup of flaked fish every week. That's more than Americans typically eat. In 2012, the average seafood intake was 1.3 servings per week, slightly up from 1.1 servings a week in 1999. The article then goes on to say a little bit later, the advisory said people should focus on eating fish with high levels of omega-3 fatty acids, including certain types of salmon, mackerel, herring, lake trout, sardines, and albacore tuna. Other types of fish and shellfish, including cod, catfish, tilapia, and shrimp, still contain omega-3s, but not in as high amounts. The key is eating several types of fish and eating them regularly, said Rim. It's important to find a variety of fish you like so you're not just having 2 servings a week of the same fish and you tire of it after a month and stop eating it, he said. You can go ahead and read this entire article over at strokecast.com/fish. If you'd like to really dig into the details and read the scientific study the article was based on, you can go ahead and find that over at strokecast.com/fish science. It's a good idea to note in this article that I did not see any references to whether that fish ought to be cooked or raw, just that it's not fried. I also did a search on the journal article, and I could not find any references to whether it's raw or cooked. Regardless, this article is good news because I love sushi. And sushi has an important milestone in my recovery and has, been part of a lot of key moments of my life. So let's talk a little bit about the nature of recovery. Recovery from stroke is not a binary process. You don't go from not recovered to recovered at the snap of a finger. It takes time, and it happens in small steps. Those small steps build towards small goals and victories, and it's important to go ahead and celebrate those victories when we encounter them, even when they're small, even when there is something as simple as moving a finger for the first time. You can take all of these small steps and build them into your overall plan to get to where you want to go. When I was first starting rehab in the hospital, one of the first things they asked me is, what were my goals for my recovery? Now, my main goal at that point was to just get back to normal. course, I'm not really sure if I really understood what that meant in those first few days. That ended up being sort of a big and very vague goal. As I went through my rehab in the hospital, through transitional rehab, through outpatient, and continue to work on my recovery today, it's in the smaller steps where I actually found the inspiration. Not about the whole get back to normal, but the little pieces of normal that happen along the way. It's where the work actually happens. You see, it's tough to focus on full recovery all the time, to get back to normal, the old normal. The problem is that's a goal that's sort of vague and amorphous, and it doesn't really latch on to what you can do today. The best way to get there ultimately is to, get a little better every day. That's why I end each episode with a reminder to don't get best, get better. It's because those little things, that getting a little better every day, that consistent growth, that consistent work is ultimately what's going to get us to our smaller intermediate goals, which build to our bigger, longer-term goals, which are all part of our recovery. But those small steps along the way, that's where life really is. And I've had a whole bunch of those. Everything from the basics of to transfer to my wheelchair in the hospital without assistance, to be able to take myself to the bathroom and manage things by myself, to be able to walk a few steps, and then to walk 10 feet further than the day before. Later on, to get to the point where I could skip wearing my AFO or my ankle brace at home and finally be able to walk around the apartment without wearing shoes again, to being able to climb stairs safely by myself, to walk around the block, and then after that to be able to walk to the donut shop and the nearby Starbucks, then to be able to walk to the grocery store, and ultimately to be able to walk to the hospital for my outpatient treatment. Other little things like to be able to hold a thermos of tea in my left hand, the one that was affected by my stroke. To be able to bring my left hand up to my mouth, to be able to hold my arm up, to more recently, to be able to turn a doorknob with my left hand. And those are all just some of those little goals, those little steps that are really all about getting back to life. And somewhere in the middle of that list was to be able to walk to Zushi. You see, back in August, I was graduating from Rehab Without Walls, or transitional rehab, to outpatient rehab. If you want to learn more about Rehab Without Walls, you can check out episode 11, where I talked with Robin Weiss. But I was graduating from Rehab Without Walls to transition to outpatient rehab at the hospital. And on my last day with Rehab Without Walls, I had a big goal to accomplish, and that was to go to lunch at the local kaiten sushi place. So my PT aide, Corey, and I planned this trip. The walk was going to be more than a mile round trip, up and down hills. And it was a good goal. It was about living the life that I wanted to get back to living. So we strapped on my gait belt and we trundled off through the neighborhoods of Seattle to go get lunch. I wanted to do this because I frequently went there before the stroke. It's a fun place. It's a kaiten sushi bar. If you've never been to one, what that means is that the food actually just comes by you on a conveyor belt. You don't have to place an order with a server. You don't have to wait for them to take your order and then deliver your order. As it comes by on the conveyor belt, you just take what you want. And then when you are done, they come over and they and they total up the number of plates you have in front of you. They do the math around the color coding on the plates to come up with how much each one costs, and then they hand you your bill. So it's a lot of fun. It can be very quick to start eating, especially if the things that you like happen to be coming by on the belt pretty quickly. Now, of course, given my physical challenges now, I had to strategize a little bit more. I had to make sure that when I sat down in the booth, I was facing the traffic of fish and had those plates coming towards me. I also found that it was easier to have the belt on my left side and reach across my body with my right hand to grab the plates as they came by. I've been coming here with my girlfriend for a number of years. Previously, it had been a place called Genki, and it went through several iterations in branding and patterns of decoration in that time. Under the Genki brand, though, it was always felt like the sushi version of a dive bar. It wasn't necessarily the cleanest place. The thermoses they used for tea all had tea stains down the side of them. Some of the condiments on the table were kind of questionable. Really, we should have known better than to eat at a sushi place like this. But they had fun things on the belt. They had very American things like hot dog rolls and avocado rolls, in addition to having more traditional sushi options on the belt as well. But we came here a lot, and it was always a lot of fun, and they had cheap beer and cheap food. Now, of course, had the American Heart Association released their fish study 25 or 30 years ago, it really wouldn't have mattered to me. I never really liked fish when I was growing up. I didn't even care for fish sticks. About the only fish I liked was tuna fish sandwiches, and those were best when they were already a day old. When you make that tuna fish one day and then you put it in the refrigerator overnight so all the flavors can meld together, let me tell you, that's the stuff. But eventually, my girlfriend got me into liking some more fish. It started with what I like to think of as gateway sushi, grocery store California rolls. And we worked through a variety of those, and gradually I came to really love it. Past 2 decades of my life, I've seen a lot of things marked by the presence of sushi. From going out with friends and coworkers to a sushi place in San Diego and watching shrimp that were supposedly dead start waving their arms and jumping around. One of the best meals of my life was at a place called Sushi Zanmai outside the Tsukiji Fish Market in Tokyo. Kathy and I went there super early. We had gone to the tuna auctions beforehand and then wandered the market looking for a good place to have breakfast. And we encountered some of the most welcoming staff we would encounter in Tokyo outside of Sushi Zanmai. We had a really helpful waiter who figured out how to even save us some money while getting us the food that we wanted. Kathy had a fantastic crab miso soup, which normally when you think of it, you might think that meant there were pieces of crab meat in the soup. No. There was a fried crab just sitting in the middle of the bowl, shell and eyes and all, and it was awesome. And what I had was some of the most amazing sashimi I have ever had in my life. The texture, the flavor, the color, it was all as beautiful as it was delicious. It was 8 years ago, and the next time I go to Tokyo, and I'm sure there will be a next time at some point in my life, I will definitely go back. Beyond that, I used to work the CES trade show in Las Vegas every January with one of my previous jobs. And at the end of the show, me and my friends and colleagues, we'd go to the sushi place in the MGM Grand. I believe that was called Shibuya. And we would order just a big platter of sushi. And we would just sort of sit back and relax after the show and joke and laugh about our next adventures. You see, good friends and good food, this is the stuff that life is made of. And it's a great reason to survive stroke and figure out how to get back to life. So here I am today. I'm still loving sushi, And thanks to this new report from the American Heart Association, I know that I am helping my heart and minimizing my risk of another stroke at the same time. And that brings us to our hack of the week. To go ahead and sticker your cane. I left the hospital with a hospital-issued cane. It was one of those standard, cheap, generic metal adjustable ones that normally sell for anywhere from $7 to $20. You can just find them at the drugstore if you ever wanted another one. And it still works for me pretty well 10 months later. I mean, maybe it does clank a little bit more, but that just makes it easier for folks to know that I'm coming. When I got my cane, I did name it Lana, and Archer fans will appreciate that, I'm sure. Before I left the hospital, my physical therapist, Megan, suggested I personalize my cane. And I thought that was a pretty good idea. Having it personalized really can help brighten the day and make it unique so you don't end up confusing it with the canes of others. So I covered my cane in stickers. It's been redone a couple of times, but, it's a lot of fun. With all of the stickers that are available out there, or even ones you make yourself, you can go ahead and decorate your cane how you like. Or, if you have kids, grandkids, nieces, or nephews, just hand them a bunch of stickers and let them decorate it. Let them help out and be a part of your recovery as well. When you do it with these cheap $10 to $20 metal canes, you really have nothing to lose. If you decide you don't like it, it's really not a big deal. You can either pick up another cane, or with the metal ones, you could even remove the stickers and get different ones if you want. It's a great, simple way to brighten your life with cool stickers. If you want to see some pictures of mine, go ahead and head on over to strokecast.com/sushi. And that's it for this week. What small steps have been meaningful in your recovery? Are you adding more fish to your diet? Go ahead and let us know in the comments at strokecast.com/sushi. Please share this episode with other stroke survivors, caregivers, industry professionals, or sushi fans. And if you have an Amazon Echo, be sure to try out the Strokecast skill. Simply say, Alexa, enable Strokecast. And, of course, as always, don't get best, get better. Thanks a lot. I'm Bill Monroe, and I'll talk to you next week.
The Strokecast, Bill Monroe, and Bill's guests provide general information and entertainment, not medical advice. Please do not make any changes to your treatment plan or the execution of your treatment plan without first consulting your personal doctor or medical team. The Strokecast is a proud production of the Currently Speaking Podcast Network.